Hey guys, welcome and welcome back to this channel. If you've not subscribed, you kindly subscribe, like, share, comment. Don't forget to turn on notification bell so that every time I post a video you'll be the first person to be notified. So what you want to talk about is which type of exercise somebody who is pregnant can do to induce labor, and what are the things you need to do when you are term. So we know that term is 37 weeks plus. Yeah. So around 38 weeks into their pregnancy, I start to see a shift in my expecting patient. This excitement of being pregnant has worn off. Now they are so uncomfortable and often feeling a great deal of pregnancy fatigue. So this also usually when I start getting question about natural ways to induce labor. So it is true that eating, these are some of the things that they usually ask. Is it true that eating spicy food will get things start going? Does drinking castor oil work? Does doing exercise really work? So I want to say some of my expecting mother are willing to try just about anything at this point of when they are at term, and the internet provide endless idea. However, I always caution that very few methods have been proven effectively in getting labor start, and some method can actually be dangerous for both the mama and the baby. So let us look at some of the natural ways that people usually talk about, and we see if they are recommended scientifically. So here are some natural 6 natural ways, and maybe I will add some that I also know. Okay, so exercise. Let's talk about exercise because this one is most of the asked question. So walking and exercising often make it to the top of the list of the things to try. Well, there are no research that say it will induce labor. 30 minutes of the moderate exercise at least 5 times a week can be helpful in any stage of pregnancy, and it is safe to use bathing or exercise ball to stretch and help relieve some of the pressure in your pelvis, hips, and back, unless you have been instructed otherwise by your doctor. Staying fit can help improve sleep and your mood, so it can also decrease your risk of cesarean deliveries and gestational diabetes. And what are the type of exercise that someone can do? We have said walking is one of them, doing pelvic exercise is one of them. You can squat, you can jump a bit, you can stretch the pelvic bones by doing yoga exercise. So those are some of the exercises that pregnant mother can do, and then labor will start when. And this exercise, they're recommended apart from walking and doing little exercise when you're pregnant. They are recommended when you're term, when you are past 37 weeks. So let's talk about spicy food. So spicy food can make you sweat, but they won't induce labor. That's an old wives' tale that people who were there long back used to say, and they never had any backup research on it. So research has shown that eating spicy food can trigger heartburn and indigestion. But as for labor, there has no documented research to prove this theory. So there is nothing like eating spicy food can make you start, or you can make labor start. Let's talk about sexual intercourse. We always say that doctors usually recommend sex. Sex is recommended when you are pregnant unless you have any complication like threatened abortion during your pregnancy, or maybe your pregnancy is at risk, is when the doctor can say can tell you to stay away from sexual intercourse. But if you don't have any complication, sexual intercourse is usually So long as you are comfortable, it is usually recommended throughout the pregnancy. So you might be wondering, how will sex induce labor? For instance, it can release oxytocin from the brain, the same chemical that causes contraction. So we know that oxytocin is the one that usually causes contraction, and without oxytocin, you can't contract and you can't give birth. That is why even in the hospital, when we want to induce you, or we want to how do we call it, when we want to augment labor, we usually use oxytocin. So the same chemical that causes contraction is this. Sex will release that oxytocin from the brain, and this oxytocin is the same chemical that causes the contraction, and it can help release prostaglandins, which help the cervix naturally soften and prepare the labor. So be sure to ask your doctor whether you have to they go ahead to give sex at this time, and then if you are given the okay, it is certainly one of the more fun way to try and get your labor going. Now again, let's talk about acupuncture and acupressure. Acupuncture and acupressure. Using acupuncture, acupressure or massage to induce labor is somewhat controversial. The belief is that stimulating certain pressure point in the body can release oxytocin and induce labor, while the effectiveness of this method is still up for the debate. So a foot massage is still enjoyable, especially at the end of pregnancy. Did I say a foot massage? Yeah, a foot massage is still enjoyable, especially at the end of pregnancy. And massage therapy can help treat the hip, back, ligaments, and musculoskeletal pain you might feel while pregnant. Both are very safe as long as the care professional and experience is taking care of the pregnant woman. So, and also I want to say that this acupuncture and acupressure can help relieve some of the pressure in specific body parts, especially the pelvic, and then the mother will be able to release oxytocin, and we have seen that oxytocin usually induces labor. So let's talk about nipple stimulation. Nipple stimulation induces labor is discouraged. Okay, some of my patients ask me whether using breast pump can help start labor. Similar to sex, nipple stimulation can lead to oxytocin release. However, there are no research that shows using a breast pump to induce labor is safe or effective. So I discourage my patient from trying this method. Nipple stimulation is okay, but using a breast pump to stimulate to induce labor, it is not effective. Yeah, it is not effective. It is not safe. Yeah. Let's talk about the castor oil. This one I saw it online. Someone was asking about if they are already at term. Can they use this castor oil? Let's see if it is recommended for induction of labor. So castor oil to induce labor highly discouraged and potentially dangerous. Reason why: castor oil can cause uterine contraction, but the contraction may or may not be labor. The theory is that castor oil stimulates the bowel, which irritates the uterus and causes contraction. This can lead to side effects like diarrhea, nausea, and vomiting, all of which can lead to dehydration. I highly discourage my patient from trying this castor thing. Yeah, castor oil is not recommended. So the last thing that I want to say about induction of labor, when you are term start from 37 weeks and above, and it goes all the way up to 42 weeks. Just know that at long last the baby will come out when the time is ready. Stop disturbing yourself. Yeah, stop disturbing yourself, causing your body to irritating your body, using castor oil, using a lot of things so that you can induce labor. Apart from exercise and those pelvic exercise, don't try this thing like castor oil, I don't know, using breast pump, and also spicy food. They are not recommended, and they are not scientifically proven. So when maybe you are postdatism, you are always advised you come to the hospital so that you get assessed if you can they can induce you. Yeah, you get assessed if they can induce you. And remember, sometimes you are trying to induce labor, it can work. Yeah, it can work. And remember, sometimes the baby is bigger than which cannot pass through the birth canal. Maybe you have some complications. Yeah, you have some complications. So all these things you have to consult first before you try even all the things that I've said that might be scientifically proven. I think I will stop from there. So let's meet in the next in the next video. Bye till next time.